Here is my unplanned pregnancy video. So I have a client comes in. First and foremost, I will listen without judgment, with the utmost compassion for the possible fears and stress and strain that they are under facing an unplanned pregnancy if they are unhappy about it. As for the prompt with Alexis, with the recent breakup and was not planning on being pregnant, I will encourage her to pour out her story, all of the ins and outs, all of the fears, and just let her say it all, and just listen. Listen with compassion and no judgment, and ask lots of open-ended questions that hopefully prompt her to evaluate her fears about the pregnancy and why this is a crisis pregnancy for her. Get to the very depth and meat of why this is a crisis for her, and then after all of that, I'm going to well, what I'm thinking is that I'm concerned for her overall health, her entire health, social, psychological, and physical well-being, and the safety and any increased risk factors that would be part of this pregnancy, or just part of her general health as a person. So my discussion with Alexis really needs to reflect her entire health and safety, not specific just to the pregnancy, because that would affect how she got pregnant possibly, and how she will make her decisions about the pregnancy. Okay, so questions to ask are, after she tells her whole story, is, and maybe to help prompt the story, is what are your specific fears? Why this is a crisis for her. Try to solicit disclosure of physical safety. What is the reason? Was this a result of assault? Is things that I'm concerned about that will frame my questioning. Was this the result of assault? Was the intercourse consensual? How old is she? How old was the boyfriend that's no longer involved? Is this possible child abuse if she's underage and it is a person greater than, 4 years when they're underage in Washington, older than her? Do I have the duty to report something, or encourage her to report something? Do I need to encourage her to go get checked out in the emergency room? Like, was this rape or incest, or like gently, cautiously explore all of those things to determine her actual physical safety. Is this somebody who is going to come back and harm her? Any of that. Other basic needs, financially, is she homeless? Is she in a supported home? Is she living by herself? Is there other potential factors, an abusive parent if she's living with her parents, or good support from the parents? Any of that, not just all the bad things, but what is good in her life too. But finances and insurance and all of that are important things to know. Food, simple general health. Does she have access to food right now? Like, what is her full situation? Is she at risk for STIs? Was risky behavior is what resulted in this, or is there risky behavior, solid relationship, but risky behavior by the boyfriend that puts her at potential risk for STIs? And that's just another general health question. And then diving in, was this a monogamous relationship before they broke up? So that would be a good question to ask to kind of figure out the STI risk situation. And then how does she feel about trusting that the boyfriend was monogamous during the relationship? And this is all to help her think about, should she get tested for STIs? When was she last tested? Was she tested? Was she aware that this was an issue and got recent testing and and all of that? And then also questions about substance abuse, just from cigarettes, marijuana, drinking to illicit drugs, IV drugs, all of that. And then once we kind of think about all of that, and hopefully we've calmed down a little bit after she tells her entire story, and then I can just ask her what her thoughts are. What do you think you want to do? What do you know about your options? What kind of support do you need based on what you know, based on her answers to her above situations and what she thinks she wants to do? So part of the decision-making progress that I use is the SURE acronym from the SURE test, which includes, do you feel sure about the best choice for you? So what does she already know about the social, emotional, and physical risks of her options, and what does she think she wants to do? And so the next SURE is the U, which is understanding. Do you know the benefits and risks of each option? And so if she doesn't, then I will discuss her options and what is in my scope to provide help with. And so any of the options are not without physical, social, and emotional risk. So the three simple options are continue with the pregnancy and keep the baby, continue with the pregnancy and put the baby up for adoption, or terminate the pregnancy. Those are the three choices. I can help, and it is in my scope to help with continuing with the pregnancy and continuing with the pregnancy but placing the baby for adoption. So I can do prenatal care, labor and birth care, and postpartum care. I can provide you resources and where to get resources for all of the things that you will need, all of the support that you will need if you decide to continue the pregnancy and keep the baby, or get you with the right people to talk about adoption options. There's option to closed adoption, open adoption, and family adoption. So asking her the questions to help her think about what her risks and benefits are to those things and what she wants, if those are the things that she just decides, how important it is to you for your baby to know you later if you adopt the baby out, or do you want to have contact with the baby, those kinds of things, and getting her to the support that she needs to help find how to do it and all of that. The abortion option is, I will inform Alexis that for the safety of my clients, it is important for me to practice within my scope, and it is not in my scope of practice to provide abortions. And I will let her know that the information is readily available and it is easy to access. If she asks more questions about abortion, the legality in Washington is, again, readily available and easy to access in Washington. It is legal up to viability, and viability is considered 22-ish weeks. It depends on the provider. So medical abortion is the early pregnancy, first trimester, up to 16 weeks legally, but works best if it's under 10 weeks. The state, so the laws read, every individual has the right to choose or refuse an abortion. The state may not deny or interfere with the woman's right to choose to have an abortion prior to viability of the fetus to protect her life or health, and no abortion may be provided after viability. So in Washington state, after viability, it is not legal. Only a physician licensed by the state may provide a surgical abortion. So that's your first trimester or later abortion. So 12 to 22 weeks, 12 to 20 weeks in Washington. And ARNP can prescribe the medicines for medical abortion, and those are the legalities. And if she is interested in understanding more specifically about the procedures, I know all of that information and will give that to her if she asks, and talk about the risks that are involved, but only if I'm directly asked. And let's make sure I'm hitting everything that was in the prompt. Oh, and so then after all of the discussion, I can ask her, do you need more information to make a decision? And then encouragement from the SURE test. So the R from the SURE tests are you clear about which benefits and risks matter to you most? And so that's really, we would really have to talk about all the benefits and risks of each option. I imagine when she first comes in a crisis, she may not be ready to hear that. So it's important to let her know about the timeline, which I already talked about, but then making sure that she's clear about benefits and risks. And then the E is encouragement. Do you have enough support and advice to make a choice about this option, about these options, and what's best for you? And then I think that to help her make a decision at this point is that we really need to be very clear on dating so that she knows how much time she has to think about things, get a complete health history like I talked about before, including all of the social and psychological parts and any other risk factors, so heart disease or diabetes or anything else that can impact a pregnancy, just like I would for any other client coming in. Again, determine accuracy of dating, and I would highly recommend an ultrasound for dating. I would still want to draw a prenatal lab and blood type and RH factor because she needs to know if she's RH negative, if nothing else, for program purposes, and then a UA and STI testing, and then if she discloses any drug use, the UDS testing. I recommend clients if there's illicit drug use or even marijuana use disclosed. A general physical exam for health, and then a pelvic exam, including a bimanual exam for size, dates, information, and then a PEP if indicated. So if she's 21 and hasn't had a PEP, or if she has signs and symptoms of HPV infection or any of that. So that is my unplanned pregnancy video.